Hi everyone! Welcome to our video on 6 more things to avoid if you're taking amlodipine or Norvasc. Our last video was on 6 things to avoid if you are taking amlodipine, and we had many comments and questions about the subject, so we're going to talk about more foods, different medications, and some alternative medicines that can interact with amlodipine to either increase or decrease its effectiveness. Please note that, when taking amlodipine, it is important to be aware of potential drug interactions and understand the medicines that may not be safe to combine with this medication. However, if you find that you need to take another medication while on amlodipine, you should speak to your doctor or pharmacist about safe alternatives available that can help you manage your condition effectively. They may recommend alternative medications or adjust the dosage to minimize the risk of potential negative effects. It is crucial not to make any changes to your medication regimen without proper medical guidance. It's also important to know that every medication has side effects, and it's best to know which is appropriate for you and what to avoid when taking them. Before we start, let's talk about what amlodipine is. Amlodipine is a medicine commonly prescribed to treat high blood pressure and chest pain. And by reducing blood pressure, they reduce the risk of cardiac complications, stroke, and kidney disease. It belongs to a class of drugs called calcium channel blockers, which work by relaxing and widening blood vessels, allowing blood to flow more easily. This helps to lower blood pressure and reduce the workload on the heart. The main enzyme responsible for metabolizing amlodipine is CYP3A4, which is found predominantly in the liver. It oxidizes amlodipine into inactive metabolites, which do not contribute to its blood pressure-lowering effects. It is important to note that the metabolism of amlodipine can be influenced by other medications and substances, which we will discuss in this video. Now let's talk about the things that should be avoided if you are taking amlodipine. Number 1. Ginseng. Ginseng is a popular herbal supplement derived from the roots of the Panax ginseng plant. It has been used for centuries in traditional medicine to improve physical stamina, boost immune function, and enhance mental performance. It contains active compounds called ginsenosides, which are believed to be responsible for its various health benefits. Ginseng has been found to induce certain liver enzymes responsible for metabolizing drugs, including amlodipine. This means that taking ginseng alongside amlodipine can increase the metabolism of the medication, resulting in lower levels of amlodipine in the bloodstream. As a result, the effectiveness of amlodipine in lowering blood pressure and managing hypertension may be compromised. It is important to note that everyone's body reacts differently to medications and supplements. While some individuals may not experience any adverse effects from combining ginseng and amlodipine, others may experience serious complications. It is always best to consult with your doctor or pharmacist before adding ginseng or any other herbal supplement to amlodipine. Number 2. High-fat dairy products. The absorption of amlodipine into the bloodstream is influenced by various factors, including the presence of high-fat dairy products in the digestive system. When high-fat dairy products are consumed, the fat content slows down the rate at which the medication is absorbed. This can lead to a decrease in the concentration of amlodipine in the bloodstream and, consequently, a decrease in its effectiveness. Additionally, the liver plays a crucial role in the metabolism of amlodipine. It breaks down the medication into inactive metabolites, which are then eliminated from the body. However, the consumption of high-fat dairy products can interfere with this process. The liver is responsible for metabolizing dietary fats, and when it is occupied with breaking down these fats, it may not be able to effectively metabolize amlodipine. As a result, the medication may stay in the body for longer than intended, leading to potential side effects or even toxicity. Number 3. Echinacea. Echinacea is a widely known herbal supplement that has gained popularity for its potential health benefits, particularly its immune-boosting properties. Many people turn to this herb during cold and flu season, hoping to ward off illness and strengthen their immune system. Echinacea is often used to treat symptoms of the common cold, such as sore throat, cough, and fever. It is also believed to have antiviral and anti-inflammatory properties. Combining amlodipine and echinacea may pose potential dangers to your health. It is crucial to be aware of these risks before considering adding Echinacea to your daily routine if you are already taking amlodipine. One of the main concerns is the potential for Echinacea to interfere with the effectiveness of amlodipine. Amlodipine works by relaxing and widening the blood vessels, which helps to lower blood pressure. However, Echinacea has the potential to counteract this effect and could potentially lead to an increase in blood pressure. This could undermine the benefits of taking amlodipine and may have adverse effects on your overall health. Additionally, individuals may experience allergic reactions to Echinacea. If you are allergic to Echinacea and still choose to take it while on amlodipine, it could potentially worsen your allergic reaction and lead to severe symptoms like difficulty breathing or swelling of the face, lips, tongue, or throat. To ensure your safety and well-being, it is crucial to consult with your doctor or pharmacist before combining amlodipine and Echinacea. They will be able to evaluate your specific health condition, medications, and potential risks. Number 4. Liquorice Root. Liquorice root, also known as Glycyrrhiza glabra, has a long history of use in traditional medicine. This versatile herb has been used for centuries for its medicinal properties and unique flavor. It can help soothe irritated tissues and reduce inflammation in the body. This makes licorice root a popular remedy for conditions such as sore throat, cough, and digestive issues. Licorice root contains a compound called glycyrrhizin, which can increase the levels of a substance called aldosterone in the body. Aldosterone is a hormone that regulates fluid and electrolyte balance, including the balance of sodium and potassium. The combination of licorice root and amlodipine can lead to increased levels of aldosterone, which can cause sodium retention and potassium loss. Sodium retention can lead to fluid retention, increasing blood volume and raising blood pressure. Potassium loss, on the other hand, can lead to low levels of potassium in the blood, which can result in muscle weakness, irregular heartbeat, and other cardiovascular issues. Additionally, licorice root can also inhibit the breakdown of amlodipine in the body, leading to higher levels of the drug in the bloodstream. This can increase the risk of side effects associated with amlodipine, such as dizziness, headache, and flushing. Number 5. Macrolide Antibiotics. Macrolide antibiotics, on the other hand, are a group of antibiotics commonly prescribed for the treatment of various bacterial infections. They work by inhibiting the growth of bacteria, helping the body fight off the infection. Macrolide antibiotics are commonly used to treat respiratory tract infections, skin infections, and sexually transmitted infections. While both amlodipine and macrolide antibiotics are effective medicines in their own right, they should not be taken together. The reason behind this is the potential for harmful drug interactions. Macrolide antibiotics, such as erythromycin and clarithromycin, can interfere with the metabolism of amlodipine, leading to elevated levels of amlodipine in the bloodstream. This can increase the risk of side effects such as dizziness, low blood pressure, and an irregular heart rhythm. Number 6. Ketoconazole and Itraconazole. Ketoconazole and Itraconazole are both antifungal medicines. Ketoconazole is used to treat various fungal infections, including those of the skin, nails, and hair. Itraconazole, on the other hand, is used to treat a wider range of fungal infections, including those of the lungs, mouth, throat, and nails. These antifungal medicines work by inhibiting the growth and reproduction of fungal cells, ultimately eliminating the infection. A study published in the Journal of Clinical Pharmacology examined the effects of co-administering amlodipine and ketoconazole in healthy individuals. The researchers found that ketoconazole significantly increased the plasma concentration of amlodipine, which means that the levels of amlodipine in the blood were much higher than expected. This is important because higher levels of amlodipine can lead to a higher risk of adverse effects. Another study published in the British Journal of Clinical Pharmacology investigated the potential interaction between amlodipine and itraconazole. The researchers discovered that itraconazole also increased the plasma concentration of amlodipine, similar to what was observed with ketoconazole. These findings suggest that both ketoconazole and itraconazole can inhibit the metabolism of amlodipine, leading to higher levels of the drug in the body. Therefore, it is crucial to consult with your doctor or pharmacist before combining amlodipine with ketoconazole or itraconazole, as they will be able to assess your specific situation and advise on the best course of action. Thanks for watching. If you enjoyed this video, like, comment, and subscribe, and click on the bell icon so you never miss a video. We wish you all the best for your health and well-being.